Recently, the US president made a decision that shook the entire pharma industry. He announced 100% tariffs on medicines coming from India and several other countries. This meant that a medicine that used to cost $10 in the US from India would now cost $20. The Trump administration called it a step to promote Made in America. But in reality, it was a direct economic attack on India's growing pharma strength. The question was, would India bow down? The answer? Absolutely not. India turned this battle not into a war, but into a strategic game. The government and the pharma industry worked on 4 fronts. 1. Expanding presence in new global markets. 2. Strengthening domestic production. 3. Reinforcing the supply chain. 4. Building stronger global partnerships. The ships that used to head to the US now sail to Europe, Africa, Latin America, and Russia. Companies like Dr. Reddy's, Cipla, Lupin, and Sun Pharma are now supplying medicines directly to Africa, Russia, and South America. The US closed a door, India opened new windows, Russia, Europe, Africa all signed new deals with India. Countries like France, Germany, Brazil, Egypt, and Indonesia said, if you want medicines, the route is through New Delhi. India's pharma industry scaled up production multiple times. Government initiatives like PLI schemes and bulk drug parks played a key role. India proved it is not just a supplier but the lifeline of global healthcare. Now the situation changed drastically. Generic medicines in the US started running short. A drug that used to cost $10 from India now costs $200. Hospitals are struggling, insurance premiums are skyrocketing, and the healthcare system is in chaos. US media headlines now read, India, the new lifeline of global healthcare. India showed the world that business is not only about profit, it's about humanity. India ensured life-saving medicines reach Africa, Asia, and smaller countries without bureaucratic hurdles. Strategy with intelligence, heart with humanity. This became India's identity. Make in India, heal the world. India has set a new mission, Self-Reliant Pharma Mission 2030. Goal, by 2030, produce 100% of APIs domestically. New pharma hubs are coming up in Himachal Pradesh, Gujarat, Telangana, and Uttarakhand. Sun Pharma is building a new API plant in Dubai. Dr. Reddy's is opening a production unit in Russia. Cipla has started a project of 40 new medicines in South Africa. Now the US is forced to think, who did we mess with? The truth is, India is no longer just a market. It has become the lifeline of the world. Medicines that were once affordable for the poor in the US are now a luxury. The US tried to block India, but now it has to look to India for treatment. India has quietly, calmly, and strategically won this economic battle. India is no longer just the pharmacy of the world. It's becoming the doctor of the world. Now the question is yours. Can the US stop India? Or will India, through its pharma diplomacy, become the true global health hub? Comment below with yes or no and share your thoughts. Text on screen. India, not just a market, the heartbeat of global healthcare.